Okay, so this is the dorsal aorta or the abdominal aorta right here. And the celiac artery, so if you keep going following the dorsal aorta down, right here, underneath by the kidney area, it's basically this split right here. This split right here going towards this side. Yeah, right? Is it that right? Celiac artery, so when you follow the dorsal aorta down, right by the kidney, it splits towards this side right here. If you see this split right here, this part is going this way right here. And the renal arteries and veins, so these are renal veins, the ones that go into the kidney. And the renal arteries also follow the renal veins into the kidney. So you can't really see them here, but they're going to be following the same path into the kidney. And what is next? Oh, anterior and posterior splenic veins. So this is the spleen, and on the larger side you have the posterior splenic arteries, and on the smaller end you have the anterior splenic veins. And okay, external iliac artery. So if you see this one right here, this large V right here, that's the external iliac artery, and then the smaller V within this larger V, so right here, that's the internal iliac artery, and the common iliac vein is right here. So right when this split occurs right here, there's a split here, so right here, you can see a split right there. So right after the split and right before this split is just this portion right here, the common iliac vein. And if you keep going down the split, so this outside portion is the external iliac vein, this inner portion is the internal iliac vein, and running along the leg, this is the femoral vein, and the one that's when it splits off into the more into the medial side of the leg, that's a deep femoral vein. Oh, it's going to be running along the same thing. You can't really see it here, but this is supposed to be the femoral artery and deep femoral artery. It's like basically running the same path, but it's just not going to be blue.